Another day, another video of first aid by. The secret of successful Motrin for fever, first aid by. Overview of Motrin. Motrin is a popular over-the-counter medication used to treat a variety of ailments, such as fever, headache, arthritis, muscle aches, and menstrual cramps. Developed by Johnson & Johnson, it has been available in the United States since 1974. Motrin contains ibuprofen, an anti-inflammatory drug that helps to reduce pain and swelling. It is available in both liquid and tablet form and is widely used by adults and children alike. Motrin is taken orally and is considered safe when used as directed. It is important to note, however, that it should not be taken for more than 10 days without consulting a doctor. What is fever? Fever is a common medical symptom defined as a higher than normal body temperature. It is usually a sign that the body is fighting an infection or illness, and can range in severity from mild to life-threatening. Fever is a natural response of the body and can often help it to heal itself. Symptoms of fever can include chills, headache, fatigue, and sweating. Depending on the cause of the fever, other symptoms may be present. Treatment of fever typically involves medications to reduce the body temperature and fluids to prevent dehydration. Uses of Motrin for fever. How Motrin works to reduce fever. Motrin, also known as ibuprofen, is a non-steroidal anti-inflammatory drug, NSAID, used to reduce fever and ease other symptoms associated with inflammation. It works by blocking the production of prostaglandins, chemicals in the body that cause pain, inflammation, and fever. Motrin can be taken orally in tablet or liquid form, or topically as a cream or gel. It is an effective and safe medication for reducing fever, as well as for treating other ailments such as headaches, muscle aches, and menstrual cramps. It is important to note that Motrin should not be taken for more than 10 days and should not be used in children under the age of 6 months. Dosage and administration. Motrin is an effective, over-the-counter medication used to treat fever. It is important to take Motrin correctly in order to maximize its effectiveness. The recommended dosage for Motrin is 200 to 400 milligrams every 4 to 6 hours for adults and children over 12 years old. For children under 12 years old, the dosage should be determined by a doctor. Motrin should be taken with food or milk to reduce the risk of stomach upset. It is important to not exceed the recommended dosage and to consult a doctor if symptoms persist or worsen. Side effects of Motrin for fever. Common side effects. Motrin is a common medication used to reduce fever, but it is important to be aware of potential side effects associated with its use. Common side effects of Motrin for fever can include nausea, vomiting, stomach pain, diarrhea, constipation, headache, drowsiness, and dizziness. In more severe cases, a person may experience an allergic reaction such as hives, difficulty breathing, or swelling of the face, lips, tongue, or throat. It is important to contact your doctor immediately if you experience any of these symptoms after taking Motrin for fever. With proper monitoring and supervision, Motrin can be a safe and effective way to reduce fever. Serious side effects. Motrin is a fever reducer commonly used to treat fever. While it is a safe and effective fever reducer, it is important to be aware of the potential side effects of taking Motrin. Serious side effects of Motrin for fever can include rash, hives, itching, difficulty breathing or swelling of the face, throat, tongue, lips, or eyes. If you experience these symptoms, it is important to seek medical attention immediately. Additionally, other side effects can include nausea, stomach pain, headache, dizziness, and fatigue. It is important to speak with your doctor before taking Motrin to determine if it is right for you. Interactions with medications and foods. Drug interactions. Drug interactions are an important consideration when taking medications. Different medications can interact with each other and with foods and beverages, and can lead to serious side effects. It is important to talk to your doctor or pharmacist about any drugs you are taking, including over-the-counter medications and supplements. Your doctor or pharmacist can provide advice about how to avoid or reduce the risk of drug interactions. It is also important to be aware of the potential for food and beverage interactions with medications. Food interactions. Food interactions refer to the potential interactions between medications and foods. These interactions can be beneficial, such as when foods or beverages are used to enhance the absorption or effectiveness of a drug, or harmful, as when foods or beverages can interfere with the absorption and effectiveness of a drug. It is important to be aware of food interactions when taking medications as they can affect the safety and effectiveness of a medication. Alternatives to Motrin for fever. Other medications. If you are looking for an alternative to Motrin for your fever, there are a number of options available. Acetaminophen is a popular over-the-counter fever reducer that has been proven to be safe and effective. Ibuprofen is another option, and it is a non-steroidal anti-inflammatory drug, NSAID, that is often used to reduce inflammation and fever. For those who prefer natural remedies, there are herbal teas, such as ginger or chamomile, which are known to reduce fever. Natural remedies. Natural remedies are an effective alternative to over-the-counter medications such as Motrin for fever relief. Herbal teas, such as chamomile or peppermint, can help to soothe the fever by encouraging sweating. Other remedies include taking a lukewarm bath or applying cold compresses to the forehead or neck. A diet rich in vitamin C, such as citrus fruits, can also help to reduce a fever. Thanks for watching.